Welcome back to Black Joy Interrupted, where we don't just report the interruption, we break it down, expose the blueprint, and talk about what it means for our communities moving forward. Before we jump in, please like the video. If you haven't already, please subscribe to our channel and share it with someone who needs the real story behind these headlines. All right, let's get into it. While everyone was focused on the circus in D.C., something else slipped into law on July 4th. A policy tucked inside the One Big Bill lowered the federal loan limits for graduate-level nursing degrees. On paper, it looks like a quiet classification tweak. In reality, it hits the Black community the hardest, especially Black nurses who are already underrepresented and already carrying the heaviest student loan burdens. So let's break this down piece by piece. Under the old rules, nursing students pursuing grad level or advanced practice degrees could borrow up to $50,000 a year. Under the new rules, that number drops to $20,500. Total lifetime cap, $100,000. Traditional RN and LPN programs aren't impacted. This hits graduate-level nursing like nurse practitioners, nurse anesthetists, clinical specialists, advanced practice nurses, and leadership and educator tracks. These are the nurses who diagnose patients, deliver babies, manage chronic illnesses, support surgeons, hold entire hospital units together, and provide the kind of culturally competent care that literally saves Black lives. But here's the problem. Many grad-level nursing programs cost between $15,000 and $43,000 a year. Private schools can hit $33,000 a year by themselves. Nurse anesthesia programs often cost $120,000 to $140,000 in total. Tell me how a $20,500 cap covers that. Tell me how a Black nurse, already more likely to rely on loans, is supposed to cross that bridge. Tell me how Black men and women working to advance in this field are supposed to survive a system that keeps taking resources away while demanding they solve a national healthcare shortage at the same time. Representation in healthcare is already a matter of life and death. When Black nurses are present, outcomes improve. Black women get listened to. Black men get taken seriously. Warning signs don't get brushed off. And patients survive situations that would have taken them out. This policy makes that harder. Now, before we go further, let's clear up the confusion because the news cycle has been a mess. Here's what's true. The professional versus non-professional label is an internal classification used for loan limits. Traditional 2-year and 4-year nursing programs are not impacted. The caps hit graduate-level nursing only. But here's what else is true. Graduate nursing is the pipeline for nurse practitioners. And let's be real for a moment. The rollout of this information wasn't just confusing, it created chaos. Nursing organizations across the country started raising alarms because the announcement was vague, poorly explained, and spread across social media without context. Some headlines made it sound like all nursing programs were being stripped. Students panicked, parents panicked, nursing faculty panicked. Schools even reported an increase in emails from students asking if they should switch majors or delay applying to graduate school. And even though the DOE insists this definition has existed for decades, that doesn't erase the impact of enforcing it now. Because the highest levels of nursing education, the programs that turn students into nurse practitioners, certified registered nurse anesthetist, clinical nurse specialist, and nurse midwives, all require graduate degrees. And those are the programs now capped at $20,500 a year. These are the nurses who run trauma units, stabilize patients in emergencies, diagnose illnesses, write prescriptions, oversee clinics, manage underserved communities, and make life-saving calls when doctors aren't present. So when you cut funding at the top of the nursing pipeline, you eventually weaken the bottom too. Fewer advanced nurses means fewer clinical instructors. Fewer instructors means fewer available nursing school seats. Fewer seats means fewer new nurses entering the workforce at all. Hospitals have already been warning for years that the nurse practitioner and certified registered nurse anesthetist shortage is reaching crisis levels. This didn't help. This creates another barrier. This tightens the gate. This reinforces the idea that only people with wealth can afford to move up the ladder. Nurse anesthesia programs cost far more than the new cap. Black nurses are disproportionately likely to need federal loans. Black communities already face shortages in culturally competent care, and cutting the loan amount still cuts access. So no, this isn't the end of nursing as we know it. But yes, this absolutely makes it harder for Black nurses to enter the highest paying, most needed, and most impactful roles in the entire healthcare system. There's always this moment in these conversations where Black folks get painted as overreacting until the same issue hits another community. Then suddenly it's a national crisis. Black people warn the country about a danger long before it reaches the suburbs. This nursing issue is no different. When Black nurses disappear from the workforce, the health outcomes drop for everybody. Your grandmother feels it, your newborn feels it, your neighbor with a chronic illness feels it. This country runs on nursing care, and nursing care runs on people, not politics. We feel the consequences first, others feel them eventually, but make no mistake, everyone feels them. And when you pull the thread just a little, the bigger pattern shows itself. Cuts to DEI, attacks on equity programs, removing pathways that once helped Black professionals advance, and now loan caps that hit the very fields where we're needed the most. This is how systemic barriers evolve, quietly, sneaky, technically, and wrapped in classification language, while the impact lands squarely on our community. What this really shows is something we've been saying for decades. When policies change, our community feels it first. Black nurses aren't nice to haves. They've always been essential. They catch symptoms others overlook. They protect Black mothers in delivery rooms. They advocate for Black male patients whose pain is dismissed. And they build trust in a system not built for us. So when you shrink the pathway to become a Black nurse, you shrink survival odds for everybody who depends on them. But here's the part nobody else is saying. We're the ones reading the fine print, connecting the dots, and we're the ones breaking down how this hurts us, and eventually hurts the entire country. Because when you block Black access to nursing, it doesn't just harm our families. It destabilizes care for everybody. Shortages get worse. Wait times rise, high-risk patients suffer, quality drops, and communities crumble under medical neglect. And before we get to what we can actually do about this, we need to talk about the part nobody is mentioning out loud. Because once you look past the surface-level politics, there's a much bigger agenda sitting right behind all of this. This isn't just about classifications, nor is it just about bureaucracy. This is about replacement. And when you shrink the nursing pipeline, you don't just create a shortage, you create a vacuum. And anytime there's a vacuum in this country, somebody with money is already waiting to fill it. Look around. There's a massive push right now for AI-powered telehealth companies, automated diagnostic tools, remote monitoring systems, and venture capital-backed healthcare startups promising faster and cheaper care. Companies like Teladoc, Amwell, MD Live, HealthTap, and Doctor on Demand are already expanding AI-based triage and automated care models. Startups like Thoughtful AI and Charm Health openly advertise AI-driven clinical decision tools designed to reduce the need for human clinicians. Robot nurses, algorithmic triage, AI symptom checkers, subscription-based medical advice, all being marketed as innovation, convenience, and the future. But here's the truth they're not saying. These systems only become profitable when real nurses disappear. Cut graduate nursing programs, make advanced degrees harder to reach, price out Black nurses first, let shortages worsen, let hospitals struggle, then roll out an AI solution to replace the very people you pushed out. This isn't accidental. This is policy clearing the runway for automation and profit. The same companies claiming to support nurses are quietly building products meant to replace nurses, from AI intake systems to automated chronic care management. And with billions being poured into AI healthcare markets, investors are already betting on a future where human nurses aren't necessary at every level of care. And once again, guess who gets displaced first? Black nurses, Black women, the backbone of the entire healthcare workforce. And then there's the obvious. When we're not at the top of the pipeline, we're not at the decision-making table. Cultural competency disappears with us. And when we're replaced by bots, algorithms, and outsourced telehealth, the whole country loses, especially us. They're not just defunding the nursing pipeline, they're replacing it. But here's the part they never expect. When we understand the game, we stop playing defense, and we stop waiting for systems that were never built for us to protect our future. Now, I know what I'm about to say sounds a little out there, but hear me out. We don't have to wait for this administration, heck, any administration or any party to suddenly care. There are 32.9 million Black adults in the U.S. If every one of us contributed just $5 a month, $60 a year, we'd generate almost $2 billion annually. That's enough to put Black nurses through grad school, build our own scholarship pipelines, fund Black-owned clinics and urgent care centers, support Black homeschooling networks and charter schools, create grants for Black students shut out of federal aid, cover emergencies, houselessness, groceries, and rent, launch new businesses and hire our own, and keep our wealth circulating where it belongs. That's real power, that's self-determination, and that's nation building without permission. And this is just the beginning because this flows directly into politics. Malcolm X already told us, the ballot or the bullet. He wasn't talking about violence. He was talking about leverage, power, and options. If we can fund our own education, we can fund our own candidates and support leaders who actually fight for us. We can build a political force that reflects our values instead of begging to be seen. We could even create our own political organizations, our own PACs, our own local coalitions, and our own policy agendas that force the conversation. Because let's be honest, the Democratic Party only moves when pressure is applied, when money is organized, and when voting blocs show they're serious. I mean, the 92%ers didn't appear out of nowhere. If our interests aren't taken seriously, we can primary status quo Dems out. We can challenge seats, and we can put contenders in place who answer to us rather than answer to donors who never step foot in our communities. This is what collective power looks like. Not waiting, not hoping, and not begging, but organizing, funding, voting, and protecting ourselves on purpose. Now, we want to hear from you. Do you know anyone who's going to be impacted by this classification and loan change? Do you believe our community could transform itself if we funded our own progress, our own students, our own nurses, and our own future? Drop your thoughts in the comments, and seeing how you made it this far, drop a fire emoji or a black heart emoji so we know that you're rocking with us. Before you go, please like this video, subscribe to our channel, and share it with someone who needs to understand exactly how these policies hit our communities first. You've been watching Black Joy Interrupted, where every interruption gets exposed and its blueprint is brought to light.